Thank you, Senator. Your next question is from the Council President from the City of Syracuse, New York, the Honorable B. Gonzalez.
Senator, I look forward to welcoming you in Syracuse, New York fairly soon. Latinos view access to quality health care as a critical issue. Yet our current health care system is costly, fragmented, and fails to provide adequate services to the Latino community. One of our Chicago voters said she flew to Mexico for medical treatment because these trips are less costly than the price of one appointment at home. As President, what will you do to address the health care crisis?
Well, I've already mentioned my plan. My goal at the end of my first term is that there is not a single American who cannot get health care in this country, not one. And that means that those who still have employer-based health care, that we are working with their employers through things like catastrophic reinsurance to lower premiums, savings to be passed on to their workers. It means that if you don't have health care, that you can buy into a pool, a plan like the federal health care plan that I enjoy. The plan should emphasize prevention. It should not discriminate for pre-existing conditions. We've got to make sure that we're negotiating with the drug companies for the cheapest available price on drugs. We have to help providers by helping equip them with information technologies that can reduce errors, reduce paperwork, improve quality of care, manage the chronically ill more effectively. And we also have to close the healthcare disparities that exist all across this country. The Latino community and the African American communities, on every indicator, are more likely to be sick, more likely to be uninsured, less likely to be screened for things like breast cancer. And the reason is because they generally don't have primary care, and oftentimes, despite working 2 or 3 jobs, have to wait until they are so sick that it becomes much more expensive. This is something that you're experiencing in your communities, and the federal government has to step up, because when we don't, all the burden is going on you as local officials. So whether you're at a county level or at a state level, city level, you're seeing what's happening to your budgets. They're blowing up because of Medicaid and other expenses, and the federal government has to step up. Now, in order for this to happen, we've got to build a coalition in this election for change. And the Hispanic community has to be at the heart of that coalition. We are going to have to hold members of Congress accountable. We're going to have to hold me as president accountable to actually deliver on this, because the drug companies, the insurance companies, and the HMOs will continue to try to block reform in this area because they're making significant money on it. And the only way that we're going to bring about change is that if all of us join together and make sure that we understand now is the time for us to finally provide universal health care in this country. It's going to be one of my top priorities.
Thank you, Senator.